Okay, well, it's 1 o'clock. I think we will go ahead and get started because we have a lot of information to share with you all today. Thank you for joining the April eLearn call. Our topic for today is tools for evaluating partnerships, working relationships, and work outcomes. The NCRC's evaluator, program evaluator, Kathleen Cullinen, will be presenting on this call today. We do have a lot of information, like I said, so I'm just going to go over a few housekeeping reminders first. Please turn down your computer speakers if you've dialed in so that we can avoid hearing any echoes. If you do need to take another call, please do not place us on hold. Please hang up and call us back so that we do not have interference with hold music. This session is being recorded and will be available with the slides and the supporting materials on our website after the call. We do have a couple of, we have a short video to share with you today, and also we'll be linking out to some websites. So we're hoping that the video portion will go well. We're asking you at that point, you should turn up your speakers, your computer speakers, so that you can hear it clearly. Hopefully we won't have too much interference. The video is only about 2 minutes long, so we're keeping our fingers crossed that will go smoothly. So let me page through here. So, excuse me. So we're lucky to have Kathleen on board as our in-house evaluator, as I mentioned, and she has really helped us to drill down and assess some of our work plan activities. We are actually currently utilizing a program called the Partner Tool, which she has introduced to us, and she'll briefly review that with you all here today. But the purpose of this call is not only to just introduce the tools, but also to help you assess the efficacy of your working relationships and project outcomes, and also to understand and apply the concepts and strategies and steps to identify how organizations work together and how to assess organizational readiness for collaborating before measuring your outcomes. So I want to introduce Kathleen quickly. She joined the NCRC last year to develop a national evaluation framework to show the impact of our work, our TA and capacity building initiatives. She holds a BS in biochemistry, an MS and PhD in nutrition, and is also a registered dietitian. For more than 20 years, she worked in public health programs related to chronic illness and communicable disease prevention. And in more recent years, she has served in national leadership roles related to the evaluation of policy, system, and environmental interventions to prevent obesity and related health issues in vulnerable populations under the USDA SNAP program. We welcome Kathleen, and we thank you for joining us to share your expertise with us on this call today. So I'm going to turn it over. She's actually in the office with me, so she's right here.
Great. Thank you, Judy, and good afternoon or good morning, everyone. It's great to be with you today, and it's great to have Judy's technical support here to help me out. I just wanted to start out at talking a little bit about the terminology that we use in partnerships, because I know it can get very confusing at times. We're certainly referring to partnerships on this call in the context of collective impact, but just know that partnerships can also be known as networks, as communities of practice, as communities of learning, as communities of practice and learning, as work groups, collaboratives, committees, coalitions, and even task forces, although task forces are term limited. Once a specific activity or an outcome is accomplished, then the task force will typically disband. But many of these terms are very interchangeable, and it can get confusing, so I just wanted to open up with that, with all of the terminology, which is interchangeable. Okay, so what is collective impact? Some of us may actually be using collective impact approaches in our current work and not even really knowing it or not using that terminology to describe our work. But this is a relatively new concept that actually came to light in 2011 with the publication of an article by John Kania and Mark Kramer. They're the co-directors of the Foundation Strategy Group, which is based in Boston, Massachusetts. And this particular article came out in the winter of 2011, and so it's really expanded the whole field of public health approaches to be looking at things at more of a systemic or a population level versus that one-on-one client-centered care, direct programming type of approach. So they define collective impact right from the article as collective impact refers to the commitment of a group of important actors from different sectors to a common agenda for solving a specific social problem at scale. So this is cross sectors. It could be government, it could be private, it could be nonprofit, it could be philanthropy or philanthropic organizations, and typically at large scale or at the community level. So I just wanted to show a very brief clip of a video that was put out by FSG, Foundation Strategy Group in Boston, so that you can hear some of the members share some of their experiences with utilizing this work in their current practice. So I'm going to step aside and let Judy load the video.
Okay. This is where you want to turn your speakers up a little bit, if that helps.
Why collective impact? I'd like to say simply because it works, but really it's a framework and an approach that allows everyone to engage, and that is really critical when you think about sustained, scalable, systemic change.
Hi Judy, if I put on my volume on my computer, I can hear it without interference.
You can? Okay, good.
And take action together for complex outcomes or complex issues.
You can only really accomplish what you see, and I think that's what collective impact does, is it gives you this much broader view of the issue around you than a traditional approach does. A traditional approach keeps you somewhat siloed. This broader view, while overwhelming often, still allows you to accomplish so much more, understand so much more.
The difference between collective impact and collaboration, I think, is there's a really strong sense of interdependence when you have shared goals and shared outcomes that you're working toward. It's not just that we have to work together, we have to make sure that all of our partners succeed along the way as well. Because if they don't succeed, then our initiative won't be successful.
So collective impact has made a huge difference for us in our state. It has been able to bring together state-level agencies that haven't really worked together on teen pregnancy prevention, as well as some nonprofit organizations and other partners, to really think about how can we change teen pregnancy in our state? How can we reduce it in a coordinated manner?
We're concerned about issues of income inequality, economic mobility, and ultimately a lot of issues around poverty. Poverty is extremely complex, and collective impact is a way to think about and break it down so that there's really a directional focus, bringing multiple stakeholders on a complex problem like poverty and economic mobility.
But it also puts the responsibility on the stakeholders to come up with solutions, to work together, to leverage resources in a way that they haven't and would not outside of collective impact.
For me, it's totally
Hello?
Totally different game.
Yes.
I'm not very interested in being part of a collaborative, but I'm very excited about being part of a collective impact initiative.
Yeah.
We bring passion
I didn't hear
to this
anybody.
work, and I think the framework of collective impact helps us to make that passion into an outcome.
Okay, thank you, Judy. So that was a little clip on collective impact. Some members of FSG in Boston, Massachusetts that have shared their experiences implementing the collective impact approach within their communities. If you weren't able to hear it, of course, it's embedded in the slide deck, which you will be receiving with all of the other resources that we're going to be covering today. So sorry if you had any technical difficulties with that, but that will be available. And there are many other videos that are also available online, and I'll share some resources with you at the end of the call today. Okay, so why do we even want to use a collective impact approach? And you did hear some examples that were shared in the video if that did work properly for you. But the collective impact approach is much greater than a single service or a very narrow scope public health approach to addressing either social problems, poverty, stigma, poverty or stigma or hunger, but also public health issues or problems or chronic or communicable diseases within communities. Collective impact is an approach that takes into account all of these social determinants of health that we simply in the past used to always talk about as confounding factors when we would write up our results. The beauty about collective impact is that we can actually address those social determinants within the design of the intervention and address them because we know that they're strongly impacting health outcomes within our communities. So it takes an outcome versus a programmatic focus to our work. So rather than organizing around initiatives or programs, it organizes around stakeholders that come together around the table with shared outcomes. And these outcomes are reported regularly over time so that we can actually look at trends. Okay, so there are 5 conditions of collective impact or of collective success. And the first one has to do with those common visions. So the common agenda is something that is first talked about within the partnership as having organizations coming together around a shared vision. Sometimes organizations are already working on a particular issue. When we're engaging other partners from other stakeholder groups or even the private sectors or the business sectors, then sometimes we have to kind of sell our pitch to some of the organizational partners, and that takes a little bit of time, and that takes time to build those relationships if they're not already in place. But certainly organizations come together around a common agenda using the collective impact approach. Shared measurement systems are very important because we have different organizations that may be implementing different interventions in different sectors with different populations. So we want to not only be able to segment that data that we collect, but we also want to be able to aggregate the data and speak with one voice and report on our collective impact approach as a whole outcome as well. But then we also will be able to tease out what type of intervention is working well in what sector and what population and what jurisdiction, with the ultimate goal of expanding successful interventions beyond the jurisdiction that we're currently working within. Okay, mutually reinforcing activities is a third condition of collective impact. And this is very important, and this is actually the beauty of collective impact, because these are activities that are differentiated, but they're also synergistic. So instead of just working on one-on-one programming, which is also very important in client-centered care, we may also be addressing policies or systems within organizations or even policies at the local, state, and federal level. It really expands our work so that we're working not only vertically, as I say, multi-level, but also horizontally across sectors. So all of these activities work together synergistically to help us achieve these common outcomes or goals that are set by the partnership as a whole. Okay, and continuous communication. Of course, we all know that this is very important. Having that ongoing communication between meetings of the partnership, whether that be through listservs or whether that be through information that is shared through social media platforms, such as Judy does here for the NCRC, blogs, forums, so that direct contact, phone, email correspondence. It's very important that that momentum continues, and it is not just, the issues are just not talked about within the meetings of the partnership. And then finally, we have something that is called backbone support. These are the organizations that really carry the ball, the administrative and the logistical ball for the partnership, because we do need somebody to set up the meetings, organize the speakers, get the minutes out, just as Judy does here with eLearn. So the NCRC, for example, would be the backbone support organization for the eLearn committee, as an example. but it's very important that at least one, if not two, organizations take that lead role in organizing and disseminating the information as well. So they're also involved with that ongoing or continuous communication, the fourth condition of collective impact. Okay, I wanted to share an example or an applied approach of collective impact utilizing a program called End Hep C, San Francisco, and we do know that May is the Hepatitis Awareness Month next month, so I thought this might be a nice, timely collective impact approach to share on the call today. So End Hep C San Francisco is a multi-sector collective impact initiative. They work across government, private, philanthropic, as well as nonprofit organizations. They have 20 organizations on their collaborative. They've been in place a little bit over 2 years, and they've done some tremendous amount of work within that short period of time, which I'll be sharing with you. They utilize evidence-based practices, community wisdom, not only from the provider perspective, but also from the individuals that are affected by HCV or hepatitis C. And they leverage resources to work towards their common goal or their common vision of eliminating Hep C within San Francisco. They're guided by a coordinating committee. Once again, this is getting back into that terminology. You know, we've been using partnerships, but they call their partnership a coordinating committee. And there's 3 legs to their stool of the coordinating committee. They have 3 work groups. One is prevention, testing, and linkage. One is treatment access, and the third is research and surveillance related to Hep C within the San Francisco jurisdiction. And these work groups actually are open to the public. They meet monthly, and they have representatives from each of the work groups that sit on the coordinating committee. So it's a really nice flow of information, and it's a real targeted way of getting work done, work group specific work done, but yet reporting back to the larger group for input, feedback, and for disseminating information and sharing what works and what doesn't. Okay, the work groups are comprised of individuals that are affected by HCV, healthcare and social service providers, community advocates. They do advocacy work as well, so they're getting at that local, state, and federal policy work, health department representatives, and other stakeholders that work across numerous sectors, as I mentioned before, government, business, nonprofit, as well as philanthropic organizations. Okay, so their shared vision or their common agenda is to certainly eliminate Hep C so that it is no longer a public health threat within San Francisco, as well as health-related inequities, or the elimination of health-related inequities related to Hep C. Shared measurement systems, they consistently collect local data, not just the incidence, prevalence, and mortality rates related to Hep C, but also the social factors impacting Hep C treatment, Hep C engagement and care, such as stigma, such as poverty, all of the social conditions that also go hand in hand with our outcomes when we're talking about any type of public health outcome. Okay, and they have mutually reinforcing or those synergistic activities which I mentioned before. They conduct evidence-based interventions as well as continuous quality improvement. Their activities also focus on ending the stigma about Hep C and also stigma towards people living with Hep C. They focus on interventions or initiatives that treat people who use drugs with respect, ensuring access to appropriate services, and empowering individuals to reduce harm and make choices to improve their health. So it's very uplifting and an empowering approach to working with individuals affected by Hep C. And they invest in difficult to engage or marginalized populations. Now this is some of their original work. They're going into their 3rd year right now. They just completed their 2nd year evaluation report. Now they're even expanding into a peer linkage program, which is very effective. They're increasing as well as initiating Hep C screening within syringe access sites. And they're actually at the point right now entering into year 3 where they're expanding their effective interventions outside of San Francisco, so they're crossing jurisdictions. So I think it's pretty remarkable to be at this point by year 3 within their funding cycle. And they received $600,000 in 2017, which they also give out as sub-grants for small projects within the community. So they've done an incredible amount of work, and I thought they would be a prime example to highlight today of how the collective impact approach is operationalizes at the community level. So they have the continuous communication. I mentioned the 3 work groups, which are open to the public, which is ideal because we want to engage the community from the onset. And then these representatives from the work group do sit on the coordinating committee. And then the minutes, the listservs, I encourage you to Google End Hep C San Francisco. You'll see they have online blogs, success stories. They're a clearinghouse of resources, and you can really see the scope and the magnitude of the work that they do and the sectors that they're involved with. Okay, so in this case, there are 2 backbone support organizations that work on End Hep C San Francisco, and that would be the San Francisco Department of Health as well as the initiative itself, End Hep C San Francisco. And as I mentioned, they've done such tremendous amount of work. It leads me to think that they, have been working with these organizations or a number of these 20 organizations on the partnership for quite some time to be at this stage where they're actually expanding their work outside the jurisdiction of San Francisco. So that's an example of applying the collective impact approach. Okay. So just like there's 5 conditions for collective impact, there are also 5 phases of collective impact in terms of the approach. The first would be assessing readiness, and we've traditionally focused on, in public health for so long, on individual level behavior change. Some of us are familiar with the trans-theoretical model of behavior change, pre-contemplation, contemplation, preparation, action, and maintenance. And now there's being a lot of work being done, or research being done around organizational readiness for change, for implementing new policies, procedures, practices, and even programs. So that work is being expanded to the organizational as well as the community level, which is very exciting. And it doesn't mean that we're throwing out the baby with the bathwater. We still are focusing on individualized programming and public health programming and patient-centered care on individual level, but the impact is greater when we can really look at the context in which individuals are living and interfacing with their everyday lives. So assessing readiness is the first phase. And then initiating action, and this is really pulling the partnership together, conducting a baseline needs assessment, setting priorities, getting that shared vision, working on obtaining that shared vision. Organizing for impact actually encompasses all of those 5 conditions for collective impact. So by this point, hopefully you do have a shared vision or a common agenda. You have the shared measurement systems or those common indicators across interventions so that you can look at, slice the pie as well as look at the pie in an aggregate format, mutually reinforcing activities, continuous communication, and the backbone support organizations identified. So by this phase of collective impact, you have those 5 elements in place. Of course, they can be refined along the way, but you have that basic infrastructure. And then the last 2 phases of the collective impact approach include implementation and sustaining action as well as impact. So this is where you're rolling out or you're launching your interventions with the ultimate goal of sustaining your interventions within the community. Funders like to see that you have a plan, a sustainability plan when they fund you for this type of work, because when the funding cycle ends, they want to know that the work is going to be carried on, whether organizations leverage their own resources or low-cost approaches for sustaining action, such as institutionalizing policies or procedures, which don't have the cost of direct programming. And ideally, the successful interventions that you want to disseminate and replicate across jurisdictions as well. Okay. Okay. So community engagement is very important, and we can look at this as both broadly across sector in engaging government, nonprofit, philanthropic, for-profit organizations, businesses at the onset. But we also want to be have our target population at the table from the onset, not when we're launching the interventions and getting feedback, or not when we have evaluation or outcome results and we're trying to interpret what that means. We really do need to have our populations that we're working with at the table, and that's the beauty of Hep C San Francisco, is because their work groups are open to the public. They do community outreach to engage people affected with HCV and to get their input from the onset. So all the way from intervention to design to the interpretation of the outcomes, they have the input from the community. And how the community engaged depends on the goals of the initiative, but the value of having that community engagement is priceless. Also, evaluation, I just wanted to put in a little note for evaluation. It's also really important to have your evaluators, and Hep C San Francisco, for example, their research and surveillance work group is at the table from the onset of the design of the intervention. They're not handed the data or the outcomes at the end and asked to interpret them or asked how to apply those results, but they're actually part of the intervention design, just like the consumers are, or those individuals affected with Hep C from the onset. I talked already about the importance of having that shared measurement system, those common indicators. Many times interventions are so diverse, it's really so hard to, aggregate the data, but it is important to have common indicators so that we can see what works with what population and what jurisdiction and what sector, and then also be able to aggregate that data so that we can say collectively this is the outcomes that we were able to achieve as part of the organizational representation on the partnership. Also, shared measurement systems, it's very important to track trends over time, and we are certainly doing that here with the NCRC with our quarterly evaluation of our partnerships, and I'll share the tool Judy had mentioned at the onset of the call, the partner tool, and some other tools that are available online free of cost for you to use in your work as well. So this is where that continuous quality improvement comes in. Okay, so evaluating collective impact, typically there are 3 stages of development, which requires a different approach to performance measurement and evaluation. It takes time to build partnerships. This is really a new approach to public health, is working through partnerships, working through collaboratives. It takes time to engage organizational as well as community partnerships at the table, and to build that trust, to build that value, to sell, to pitch the interventions, to get input and feedback in the design, etc. So in the early years of a partnership that's implementing a collective impact approach or using a collective impact approach, understanding the context of the community is very important while designing and implementing the initiative. In the middle years, 3 to 5 years, we should expect to see some significant changes in behavior patterns, and then in the later years, we should really be able to capture some meaningful and measurable change with regard to the partnership's ultimate goals or shared vision. And Hep C San Francisco has, of course, done quite a bit within the first 3 years, so it does lead me to believe that those relationships, some of those organizational relationships and partnerships may have been on the ground at the onset, but establishing those partnerships is one of the most timely and consuming processes of the collective impact approach. Getting the right people at the right table, and having that broad representation as well as the community represented as well. So now I'm going to touch upon some of the tools for evaluating collective impact. I talked a little bit before about how we've been focusing on individual level of behavior change and how we measure that along the stages of change. This has been expanded under Weiner's research of organizational change, organizational readiness for implementing change. So there's been some research that has been done, funded through the NIH, that has looked at instituting policies, practices, or practice transformation, as well as programs within healthcare settings. So this tool was actually developed as a result of interventions that were implemented in healthcare settings at the organizational level. And we'll take you to these links. I'm just running through the tools right now. All of these will be live links when you get the webinar, and this is the resource or the reference for this particular tool, which is a 12-question tool, a very simple tool to administer. As we mentioned before, the tool that we're using here to measure the work of our collaboratives, our committees, and our work groups is the partner tool, and that's based on a social network analysis process. It's a very simple tool to use. It's hosted by the University of Colorado and was funded with some Robert Wood Johnson seed funding. So we're looking at the frequency and the strength and the quality of the interactions of our organizational representatives on our different work groups, committees, collaboratives, et cetera. There's the terminology again. We're quantifying the trust and value, not only at the organizational level, but at the partnership level as a whole. We're looking at trends in collaborative activity, whether that be communication, sharing of resources, resource development over time, and changes in relationships over time. We really want our organizations and our partnerships to be working together on an equal basis. Obviously, we have the NCRC as a backbone support organization on these committees and collaboratives, but we really would like all of the organizations to be working amongst themselves and building those networks and those ties as well. And there's different network scores that we use to measure those changes at baseline as well as over time, and we administer this on a quarterly basis. Many of you may have even completed this particular tool if you're sitting on any of the committees or collaboratives, and so may have had firsthand experience completing this. Okay, similar to the partner tool, there are two other tools that are available for measuring the effectiveness of partnerships or networks. One is the Wilder Collaborative Factors Inventory, which is based on 20 research-tested factors for success, as well as the Butterfoss Coalition Effectiveness Inventory. So those are two validated tools in addition to the partner tool that you can use. Some partnerships use one tool to evaluate their effectiveness and their outcomes over time. Some use two. Some like to compare. The Butterfoss Coalition Effectiveness Inventory has both a qualitative and a quantitative component to it. The others are more qualitative. So the Butterfoss has some advantages in terms of giving that, putting the face to those numbers. That's what I like about that particular tool. Okay, and so just how we evaluate the readiness for an organization to participate on a partnership, there's also a tool available that looks at the readiness for the partnership to start evaluating itself and its outcomes. And so this is another tool that would be administered early on in the development of a partnership. This is the Coalition's Work Evaluability Assessment Tool. So this is really specific. This is a very short tool. We'll show you easy to administer 15 yes/no questions just to get a snapshot on where your partnership sits in terms of capacity to evaluate, as well as value in evaluating their work, how they value capturing those outcomes. So now I'm going to ask Judy to give me a hand here and open up some of these links so you can just see them, and you will have them in your slide deck, but we just wanted to take a quick peek at them before we open it up to questions today.
Okay. So the first one is the readiness tool.
Right. Okay, so this is the ORIC tool, or the Organizational Readiness for Implementing Change. This is based on that Weiner's theory of organizational readiness. It was tested in healthcare settings, so it is validated and reliable, and it looks at change in commitment and change in efficacy over time. It's a 5-point Likert scale. It's very easy to administer. You could administer this on a monthly basis, a quarterly basis to your partnership. So these are some of the questions that you will see when that comes up, and that's free and it's online. And this is really an important tool when you're looking at the readiness for healthcare organizations to start implementing new policies, new practices, or new programs within the organization. Thanks, Judy.
No problem. Now we're going to open up the websites.
Yeah, okay, so this is the partner tool. This is, as I mentioned, this is hosted on the University of Colorado's website, the Center on Network Science. I won't go into it, but you can sign up. You can learn more about this tool and what it measures. It's based on that social network analysis methodology and the network scores that capture the success of the coalition or the partnership over time, what goes into it, what is coming out of it, and how the trust level is and how valuable the partnership is to the organizations that are represented on it. Okay, so now I go over to here, correct? Okay. This is the Wilder Collaborations Factors Inventory. As I mentioned before, this is based on 20 research-tested factors of success of partnerships. So this is a free online tool. You would just sign up as an organization, and it will walk you through. There are 42 questions based on those 20 research-tested factors, and it takes about 15 minutes to complete, and then you'll get a printout. So it's easy to use, and you can administer this on a quarterly basis as well. We recommend a quarterly basis. Some partnerships may do it more frequently or less frequently depending on how often they meet or what they're currently working on or what their outcomes are. So you just click through and then it will take you through all of the questions. Okay, so you can play with that. And then we have the Butterfloss Coalition Effectiveness Inventory. And this is the tool that I told you. It has a qualitative component too. It actually asks the partner organizations to list how the partnership or the coalition in this sense excels, where the coalition needs to improve, what steps the organization recommends that the coalition or partnership take to identify the challenges. So I like that, that it does capture that particular element. And then the rest of the tool is actually quantifiable based on an assessment score, looking at both the staff as well as the leaders of the coalition in terms of their effectiveness and whether or not certain characteristics are absent or present, both from the membership as well as the leadership level, and the structure and the processes of the coalition, and also the stages of coalition development, formation through institutionalization, and replicability of the outcomes within other jurisdictions of successful outcomes and successful interventions. Okay, and then we have this simple tool that I mentioned. It's only 15 yes-no questions, and this has to do, not now you have the partnership that has just come together, so this is usually typically administered at the onset of a partnership before you implement your intervention, because you want to have your evaluation design set in place, of course, before you do that. But this just asks the organizations that are represented on the partnership where they are in terms of their capacity or their interest in evaluating their work, which we know is so important. I had a mentor for many years who always said to me, you know, what gets measured gets done, and that's so true. We really do need to capture outcomes and measures all through the collective impact approach and through all phases of implementation. So it's important to gauge where your partnerships are or where your organizations are on your partnership in terms of their capacity and their interest in evaluation. We don't want things to be so burdensome for organizations so they're not evaluating, but we do need that data to show that we are making an impact and we are identifying successful interventions that can be replicated in other jurisdictions or with other populations or in other sectors of society. Okay, I'm going to ask Judy to put me back to the screen here. Great, thank you, Judy. Okay. Okay, we're not going to go into these links, but here's some additional resources that are available to you free online for evaluating partnerships. The first is the CDC Fundamentals of Evaluating Partnerships, Coalition's work resources. That's one of the tools we just showed you on the Coalition's evaluation tool is part of those resources. And then I strongly suggest, if you are interested in the collective impact approach, if you're not already utilizing it currently, is to go on and join the Collective Impact Forum. There's the link to that. There's a wealth of resources on this particular forum. This is actually through the FSG, the Foundation Strategy Group based in Boston, but they have global members. They have a list of funders, foundation funders that actually fund collective impact approaches and collective impact approaches only. So those approaches that are looking at not only the public health problem at hand or the chronic or communicable disease at hand, but all the social determinants of health that affect those outcomes of the interventions that you're implementing. So it's a wealth of resources. They've got webinars, they've got toolkits, they've got videos such as the one that you saw. They have forums where people can share, post questions. They have success stories. They've really garnered a lot of attention, and the funders includes such as Bill and Melinda Gates Foundation, Robert Wood Johnson Foundation, on and on. So it's a great resource, and then you also can get on their newsletter list as well as their email list as well, and it'll keep you up to date on what's really being done in the whole area of collective impact and the research regarding collective impact. So I'm getting my cue here, and I'm wrapping up. So in summary today, we talked about collective impact and how it is a very promising approach for addressing social or public health problems at scale that are impacted by social determinants of health. We talked about the 5 conditions of a collective success or collective impact. And then we also talked about the 5 approaches. There are free, low-cost online tools that are available for you to share to evaluate your collective impact approach. And these are the 5. Phases of collective impact. So that sums it up for today, and I'm happy to take any questions if any of you have any questions, or we can disseminate our contact information and we can email us any questions. So I'll let Judy drive now.
Thanks. Excuse me, Kathleen. Well, that was certainly a wealth of information. We appreciate you joining the call today. If you do have any more targeted questions, Kathleen's email is here on the screen, and we will also disseminate that with the materials after the call. Is there anybody that has anything that they want to ask while we're on the line here? I see that someone is mentioning that one of the links doesn't work. We'll make sure that whatever links we do post are working properly. Thank you for pointing that out.
Yes.
And it doesn't seem like anyone has any questions right now. I know that was a lot of information. You might want to digest that and come back. If there are no other calls, just to keep in mind that the next call for eLearn will be in June. I'm always open to hearing suggestions for topics. And if there's nothing else with that, we will end the call. Oh, people are typing. Any questions? No? We'll wait a few more minutes?
Sure.
Question. No? Okay. Well, Kathleen's information is available on the slides if you'd like to email her directly. I'm waiting.
someone's typing. How to gauge the readiness for a process evaluating partnerships. Okay, so we have a question that came in about, do you have any thoughts about how to gauge the readiness for a process of evaluating partnerships? Well, certainly I think that would be something that you would want to bring to the table once your partnership is formed. You really do want to have the buy-in and the input from all of the organizations and your target population at the table for how they could do that, because organizational capacity could vary from one organization to another, from sector to sector. We did talk about the importance of having those common indicators so that we can evaluate trends over time and aggregate our data, but I really think the process will lie in the hands of the partnership and what the organizations are capable of evaluating and what they can bring to the table in terms of resources to do so. This is a pretty big undertaking. Yes, it is a very big undertaking. The whole approach with collective impact really expands our work. As if our jobs aren't hard enough, now we've got to work across sectors and across all levels of the social ecological model, but the outcomes in the end are much more impactful and much more meaningful, and they address all of the social issues that typically go under the go by the wayside and are just written up in the results as confounding variables. So here we can actually address them as part of our interventions, which is the beauty of collective impact. And we have some more questions coming in, I think. Okay. The readiness assessments will aid you in helping them move forward. The less ready, the more needs to be done first to get them ready. Absolutely. John had shared this particular comment, and this really goes hand in hand with developing those partnerships at the onset and really selling evaluation to your partners. A lot of people or organizations are on board with many of the interventions, but they don't see the value in the evaluation. Okay. Are there any other questions? Well, thank you for the opportunity to spend some time with you, and please contact me if you have any additional questions. I'm happy to get back to you. Thank you so much.
Thanks, everyone. Have a good afternoon.
The leader has disconnected.